Jay, I'll turn it over to you, the Great Barrington Declaration.
Thanks, Howard. So I think let me just start very quickly with the premises of the Declaration. The first premise is that there's not possible to get zero COVID. That is an impossible goal, and we should give that up. At this point, the disease is so widespread that zero COVID would be utterly disastrous to even attempt to achieve, and it's not technically possible. A second premise is that I think everyone will agree that this is an absolutely deadly disease for people who are older and for people who have certain chronic conditions. Right. The infection survival rate from seroprevalence data, now 50 some high quality seroprevalence studies says that there's a 95% survival rate for people who are 70 and older. For people under 70, it's 99.95% survival. It's much less deadly for people who are under 70, 99.95. And for children, it's frankly, the flu is worse. We've had more flu deaths among children this year than COVID deaths, just in terms of mortality. Third premise is that lockdowns have absolutely catastrophic effects on physical and mental health of populations, both domestically and internationally. I'll talk about that, I think, going forward. But that really sort of plays a big role in the thinking about the Great Barrington Declaration. So that for people who are under 70, under say 60 or 50, that the lockdown harms are, again, mentally and physically, are worse than COVID. And so the Great Barrington Declaration is actually a call to return to sort of principles that we've had followed for many, many other infectious disease outbreaks. We protect the vulnerable with every single tool we have. We use our testing resources. We use our staff rotations on nursing homes. We use PPE. We do all kinds of things so that where people live that are vulnerable, and that older people are mainly the main group, but also many other people with chronic conditions, we can talk about strategies to do that. We do that. That's why it's called focused protection. For younger populations and people who are less at risk, frankly, COVID is less of a risk than the lockdowns. And for letting people go back to the normal activity they would do that would prevent the lockdown harms is vital. So those are the basic ideas of the Great Barrington Declaration. I mean, the key thing is context, because you're right. This is a deadly pandemic, and there's no good outcome from it. There's only minimizing harm and death by choosing policies wisely. Let me document some of the harms of the lockdowns that Mark as I've advocated for all the way through the epidemic. Among young children, the child abuse is skyrocketed. Often it's picked up in schools. Our schools have been closed, and so it doesn't get picked up there. There's domestic abuse that's happened. The CDC estimated in June that 1 in 4 young adults seriously considered suicide. 1 in 4. Normally it's something that's on the order of 4%, is now 1 in 4. The school closures have led to vast harm in terms of inequality, right? So there's going to be kids. This is probably the single biggest generator of inequality since segregation. This the lockdowns that of the schools and society more generally. Physical health, cancer screening was an 80% drop. I think you all just published a report about that in colonoscopy and mammograms. There's going to be more stage 4 breast cancers and colon cancers than we've seen in a very long time. Cancer, we actually made a lot of progress against in past few years. That's about to be reversed, if it not already is. Cardiac procedures, a drop in angioplasty, a very, very sharp drop. People stayed home. They're more afraid of COVID than getting treated for heart attacks. That's happened already with the lockdowns. These are not more internationally. The UN estimated in April that 130 million people are on the brink of starvation or potentially at risk of starvation because of the economic dislocation and harm caused by the lockdowns. Now, we talk about the economy as if it were just dollars, but it's not. I've documented, I think, already all of the devastating physical and mental harms that are caused by lockdowns, both nationally and internationally. And to say that we can't protect our vulnerable, I think that's just a failure of imagination. Logistically, it's not impossible. It's difficult, but we have to put our minds to it. I think reducing community transmission has become a crutch that's prevented us from putting our minds to it in appropriate ways. a major public health message that we failed at is describing the risk, the age grading and the risk. Older people think they're at lower risk than they actually are, and younger people think that they're at higher risk than they actually are. I think that's an enormous public health mistake. The question is, who are you harming in the meantime with the lockdown, right? A life of a child in Africa dying from starvation because of the lockdown harm on the margin is just as valuable as a life here. The life of a child abused in the United States because of the lockdown is just as valuable as a life who dies of someone who dies from COVID, who's under 65. It's all tragic. The question is, how do you minimize that harm, that death and human misery in the meantime? That's the only question, right? It's not a question of, like, we shouldn't in public health be looking at only one thing. We should be looking at everything. We should think about health much more holistically. We're not just here for infection control. We're here for maximizing human well-being, right? That's what public health and medicine is about. And I think that this singular focus on one disease has created this blind spot, I think, for the harm that we're going to cause, that we are causing with these policies.